the processes and procedures that businesses had in place and were operating with prior to COVID-19, for a lot of them, they've had to make dramatic changes in order to operate in this new reality. How does that type of change impact the safety, the security, and the work culture of an organization?
Procedures take the work practices and create a routine outcome, a consistent way of how we do something, how we create our records, how we use our tools, how we relate to each other. When we're entering into a period of fast change or rapid learning, if you want to call it that, it's important that we have a good understanding of how the practices we want people to use or perform are put in place in a document. Call it a procedure, you can call it an operating instruction or a manual. The difficulty with COVID is that no one's had any practice with what work is going to look like in the real world, unless you have been one of those few essential workers, and then you've had to learn this on the fly without procedures, most likely. So the procedures are part of what is called an administrative control. So in the hierarchy of safety, you guard the worker from the hazard or you mitigate the hazard. You can put in administrative controls like a new procedure for COVID. So as an example, how do you walk down a hallway and not bump into somebody else, right? Do you need directional arrows in your hallway? Do you need to have perspex or plastic panels between cubicles? Do you need to limit residency time in a kitchen area? This all has to be proceduralized in some way, otherwise people will forget. They need cultural artifacts. We need posters on the wall. We need videos. We need safety moments. We need managers and supervisors and staff actually talking about these things in a way where they're cautious. So even using something as simple as stop when unsure to make sure that there's no one in the hallway when you're going to walk in so you don't bump into them. So these procedures, they need to be developed in the context of the fact that people have to practice. They take time. It's now our behaviors are not habits inside these work environments, right? In the case where the procedure can't be properly implemented for COVID, you need to bring in other controls, engineered controls, like you can only go one way on a door. I've seen some organizations where instead of having door handles, they have foot stops. So they use their foot to open and close the door, right? That's an engineered barrier, but people need to have positive reinforcement or encouragement when they use a procedure properly, and when they don't, they need coaching around that procedure, which means you need a present workforce to help, right? You need the supervisors there who are familiar with the procedure, know what right looks like, not give in to the temptation of production pressure, and just push people to get something done, push people to sign things that they haven't really understood. And then you need to be able to revise those procedures quickly and retrain your workforce in a way that they understand. And it takes months to develop habits. So we're just opening the doors now into some companies that are facing outward onto a street are just going to open their doors. And those companies need to understand the procedures they have today may not be the procedures they have in 2 weeks. We may actually be, as I said, if there's a second wave, be thrown back into a space where now we don't have the doors open. But administrative controls or procedures are only one aspect. So for instance, training is part of administrative controls, setting clear expectations, part of administrative controls. Engineer controls are more the physical thing. It's also configuration management. So you have to know the configuration so that you limit the spread or reduce the likelihood of contact. You have to facilitate the procedures for contact tracing. Contact tracing is one of those things where you have to know who you spoke to. You have to know who you interacted with. Another example of an engineered control is these mobile apps that you can use where you can tell if you're near somebody. I think it was the Ford Motor Company in the US, when they opened up, they actually had an app where you would know if you're inside somebody's bubble, right? That 2 meter distance or 1 meter distance, right? So that's another form of engineered control that people or companies could look at. There are two other controls that aren't spoken of traditionally in health and safety. One is cultural controls, how we do things, what we do, what we value, what are our underlying beliefs and assumptions about how we're going to work in this world. If you have a couple of workers who are not convinced that COVID matters in terms of their colleagues' health, those individuals can put the company at great risk. And the cultural control to change those values and assumptions, it takes a lot of encouragement, it takes a lot of talking, it takes a lot of people understanding the consequences of their behaviors and actions, decisions, choices, whatever you want to call it. And then slowly over time, that undercurrent, we in this field often talk of this as an iceberg model, right? Where at the top of the iceberg, you have your procedures, you have your org charts, you have, your physical systems, you have your access controls. But underneath that, you have a set of shared assumptions and norms. So the shared assumptions and norms today are, I have to actually wear PPE, but that may not help me carry on the conversation I'm looking to have to do. So how do I do that safely in my workplace, right? So that's a cultural context as well, because nobody's actually going to write that down. Most companies think or assume common sense is common, and the truth is we all know that's not true. Common sense is anything but common.
Right.
And you can't rely on it as a leader to guide your organization. You can't think that because I know something is perfect and correct, I will wear my PPE, I will socially distance, I will not, have 7 people in an elevator today. We won't push the bubbles of people so that we invade their, call it COVID space. And that's part of that cultural context. The other control that's less understood is oversight. I think as within the public context, everyone understands that what has happened inside long-term care has shown the weakness in the government's oversight controls, and that has led to some catastrophic effects.
Right.
Oversight means you have the ability to have sober second thought. It's fundamentally what the Senate was formed for in our federal government. That's an oversight control. It's to force a conversation to make sure that, are we really doing the right things? Are we missing something? So that's an oversight control. But all of these controls, be it administrative, engineered, oversight, or cultural, they all link together in something called a system of managed defenses, or some people call it defense in depth.
So they all come together. They all are essential pieces of the puzzle to keep an organization safe.
They're all part of the organism called an organization, and they have systemic effects on each other. I don't mean systematic. It isn't one thing after another thing after another thing simultaneously, chaotically. Chaotic modeling, butterfly flaps its wings in South America and you get a storm over New York. That happens in an organization too. They are systemic effects. They are knock on each other. There's a randomness to the whole thing. And whether we like it or not, we actually, control is an illusion. Perception and culture and the values we bring control more of organizational outcomes than all the procedures and all of the physical barriers you put in place. And companies who have the forethought, who have the ability to test their culture, to test their cultural resilience, to stress test the organization, that's what really allows companies to succeed. And I would actually say stress testing it now, once you get back into this work environment, is really important, because if you do get a second wave or a third wave, you know where your weaknesses are. You've done the oversight, you've done the cultural sampling, you've measured that climate. So you know theoretically what weather patterns going to emerge when you're in certain conditions.
By actually identifying where your vulnerabilities lie will allow you to make the changes that are necessary to keep your organization as safe, secure, and healthy as possible.
Absolutely.